Thank you. This is an open letter to Premier Moe and to the Minister of Health. I have been working on this letter since October. It was interrupted because of an election. I knew that people wouldn't have time to read it or consider the issues, and by now this should be about 5 letters. So this will be the first letter, so-called letter, that I will be sending. It will be talk mail because right now as I'm getting better, it still is difficult for me to print or write a letter. But I'm getting convinced that I'm not so sure that people write or read anymore. However, I will start this letter. Since May, I've been in L'Orange Hospital, Prince Albert Victoria Hospital, Royal University Hospital, City Hospital, and I think that's all. I've been there more than once, those hospitals more than once, and I have spent some very devastating experiences because I don't think that my experiences are unique, but unfortunately are very pervasive. The COVID issue is not the big issue. The issue is that people today are being killed in our hospitals. There is no choice in this euthanasia game or assisted suicide game. My experience is that if my husband hadn't visited me, constantly tried to survey the situation, constantly ask questions, etc., that I most certainly would be dead. And because I made it very clear from the very beginning that I didn't want anything to do with euthanasia or assisted suicide, passive or active, that I wanted to live as in the tradition that patients have a right to live, and if the doctors can't cure them, they can care for them. There are many good doctors, good nurses, good people who are opposed to this and who do not practice it, that find it is unacceptable. However, we don't look at the situation about serial murders and say, oh well, they only killed X number of people, or they're only trying to kill X number of people. We have to see that murder is unacceptable, no matter what is the euphemism attached to the situation. In my experience, there is no choice in euthanasia or assisted suicide. That there is a coercion, manipulation, and the patients should be, if they understand what is going on, should be living, not should be, but are living in a state of fear. I most certainly lived in fear in all those hospitals mentioned. In the one I spent the most time, Royal University and City Hospital, I lived in constant fear I spent many nights awake because I was afraid to sleep for fear that someone would hurt me and possibly inject me or in some ways kill me. This is not unusual. We are living in a reign of terror against the sick and elderly. All the provisions for the restrictions of COVID lend themselves to isolate the sick and to make them vulnerable. They can't talk to people. They can't call out because they are distancing each other. It would appear that there is a war, especially on the sick and the elderly, and they have no choice whether or not they want to be a victim. I could tell you of some very heroic, good nurses and doctors, but when we are dealing with murders, we don't make a list of all the people who are not killing anyone. We work at stopping those who are killing someone. So Premier Moe, please reconsider this acceptance of murder as an agent in our hospitals. Help us to be protected and not in the elderly and the sick don't have to be in a constant state of fear and alienation. This will be the first of several letters that I'm going to write or send you and express to you my concerns as of someone who has experienced several months, maybe about 7 months in Saskatchewan hospitals, some of the most prestigious. This will be all for now for this letter, and I will be talking to you again. The first thing that needs to be done is to stop isolating people. Stop having it that spouses and family cannot visit. This protects the family, and it protects the family from having people isolated, and maybe even by accident. Very dangerous things are happening to our seniors and our sick. So we ask the first policy to stop is a policy of no visitors, especially between husband and wife. There's to me no question that if my husband hadn't been there, I would be killed, and I would have been killed definitely against my wishes. Thank you for now. Sincerely, Mrs. Gay Caswell, former member of the legislature and a long-term activist on pro-life issues. Thank you.